Hi, everyone. Good afternoon, and thank you for joining us today. I'm Christine Murphy with the American Academy of Nurses, and joining us today is Ashley Darcy-Mahoney, who is our 2020 to 2021 National Academy of Medicine Nurse Scholar in Residence. We're very happy to be here with all of you. Answer some questions that you may have, learn more about the program from the current scholar. So just as a reminder, we're currently accepting applications for this program. It's a full immersion experience that supports the engagement of nurse leaders in a prominent role in health policy at the national level, and facilitates interactions with other health fellows and scholars, This is a program that is jointly funded with the American Academy of Nursing, American Nurses Association, and the American Nurses Foundation in partnership with the National Academy of Medicine. And so our scholar this year, Ashley Darcy-Mahoney, some of you may know her. She, in addition to being a fellow of the Academy, she's a neonatal nurse practitioner and researcher, and has worked throughout her career to advance nursing research, education, and practice with the focus on neonatology, infant health, and developmental pediatrics. Her research has led to the creation of programs that improve health and development outcomes for at-risk and preterm infants. Currently, she's the assistant professor of nursing and the director of infant research, at George Washington University's Autism and Neurodevelopmental Disorders Institute. So with that, just quickly want to make sure that you all are aware of, I'm sure you have plenty of questions. We have a Q&A box, and as you can see from this slide that's up on your screen, it's going to show you where you can go so that you can enter your questions into the Q&A box. And then, as we get going in the conversation, we'll be sure and read off all those questions that you have. And Ashley can answer them, and if she can't, then I can. So Ashley, thank you for joining us on a Friday afternoon. Just one quick question to kick this off as we get started. What is it that made you want to apply for this NAM Nurse Scholar in Residence program?
Sure. So I just want to say hi to everyone, and thanks so much for joining. I'm excited that you all are interested in this program. It's been a really transformative experience. So I'm excited to share some of the high points for me. So one of the things that really drew me to thinking about applying for this fellowship perhaps have been a real interest in thinking about how science informs policy. Recent years certainly have made that come to the forefront of my mind, but for a very long time, child health has been, or often largely been, overlooked, or perhaps some of the science around early investments in children and early investments in development really having an important return on investment for from an economics perspective, but certainly from a child health perspective, the 0 to 5 age group is often overlooked and underfunded. And so it really struck me as a time to think about how my research could begin to inform health policy of child health. So that's what drew me to apply.
Oh, that's great. In our conversations that we've had previously, one thing that you've said is that, you applied once, but you had to apply a second time. So, thinking about on that experience, what is it, some advice that you would give to anyone who is thinking of applying to the NAM Nurse Scholar in Residence program?
Yeah, I'm actually really glad you asked that. So oftentimes, I don't think it's talked about in terms of sort of when you apply for something and don't get it, whether there's sort of a mental block or whether you should apply again, or, what is it about your application that didn't go great the first time or didn't fit. I think a lot of times, and, certainly I don't have any, window into this part, except for just my perspective, is that you may just not have been the right fit for that particular consensus study that the NAM was trying to fill, or perhaps there was someone with a different experience that was, important for that particular health policy year. And for me, it was the encouragement of actually a mentor sort of nudging me to say, why don't you try this again? Maybe this is the time that you should think about applying. Maybe you're a little bit farther along in your career, a little bit farther along in your sort of thought process and your, career cartography, as some people, would say, some of those things, and just thinking about where you are in your career and positioning yourself at the time that is right for you. And if you really want to do something, I would say, try again and make the case of why you're the right person for that particular fellowship.
Great, that's actually really good advice. So, you're about halfway or almost halfway through your year in residence. What has been the best part of the program so far? If you could describe some things that you've accomplished or have worked on so far as the NAM Nurse Scholar in Residence.
Sure. I think I'll take a few minutes to actually answer this question. So I think one of the biggest questions that I had, and I think that a few people who've reached out to me have had about this fellowship, is sort of what does the day-to-day look like? And then what is it that you actually do? So beginning in early September, just after Labor Day, is when a health policy orientation starts. And this health policy orientation is extremely intensive. You're paired with the Robert Wood Johnson health policy scholars. And so there's, depending on how many scholars they take, I think there can be anywhere from 7 to 10 of you in this cohort. And the nurse faculty scholar is always paired with them. So throughout the history of this program, we've had a cohort of people that we've joined in this health policy fellowship, or health policy orientation, excuse me. The health policy orientation is 9 to 5, Monday through Friday, with the exception of Wednesday morning, which is reading time and networking time. I think used to be a lot of having coffee with folks. I have had a lot of Zoom coffee dates this year. And so you really spend a ton of time in this health policy orientation getting briefings and, sitting in sort of a bit of lecture style, master's in public policy kind of coursework or content is how I would describe it. And that is really exciting. And I think this particular year has been really exciting because a lot of the people we talked to in September and October have now joined the Biden administration. And so it's really been kind of a fascinating time. So where we would talk to a lot of nonprofits, think tanks, people from Pew and Brookings, Cato, et cetera. And now some of those people have transitioned into the administration and some have stayed. Were career folks from the previous administration or previous administrations in HHS or CDC or OMB. And so it's been really fun to understand the inner workings of what's happening at the government level, besides just sort of how legislation is passed, but how other influencers influence policy. So from that perspective, September, October, November, and December are all this health policy orientation. So it lasts throughout that time. If it's okay, I'll take a couple more minutes to sort of a little more. Okay, good. So then in addition to that, this year was a little bit unique in that the Future of Nursing report is, consensus report is one that's being actively worked on. For me, that gave me an opportunity to join a consensus study very early on. Often you don't join a National Academy sort of a job, the job that you'll do throughout your time until after the orientation's over. But because of the timing of the Future of Nursing report, the extension due to COVID and making sure a lot of important content around the pandemic made it into the report, I was able to join that report right away. So it made the orientation a little more intensive, and that I also had this sort of other piece that I was doing for the National Academy, which I'm now doing, or continuing in that effort. So I hope that gives you a little bit of a picture of what the first 4 months were like, and I'm happy to tell you a little bit about the next 9 or 8 months will look like.
So we have a question from the audience. What barriers have you encountered while you were in this program, and what changes have you been able to make over the past year?
So I guess I'll split this into 2 buckets. So I think there's barriers related to COVID, and then I think there's probably maybe barriers that maybe everyone faced. So, and the barriers related to COVID may or may not extend into next year. So that's tough for me to obviously say. But the barriers for this year were certainly how to manage a very intensive orientation where 90% of it was on Zoom. And so we tried to have a little bit of it down at the National Academy of Medicine on site. But, as you all can imagine, that it quickly became really challenging, and we were trying to set a good example also as part of the Academy to really be thoughtful about meeting in person. And so I think the biggest challenge this year was frankly, like all of the focusing on Zoom for so long. I mean, as you all can probably imagine, it's a really intensive orientation to happen on Zoom. To continue to make the connections was, I think, a challenge, right? To connect with both my RWJF health policy cohorts, but also the people that are briefing us. I think, these are really opportunities to make meaningful relationships with policymakers, policy wonks, right? Like all the sort of people that you meet in DC. So I think that was probably a challenge. And then I'll just sort of speak from perhaps during non-COVID times or even during COVID times, certainly the barrier of being in DC full time for some people would be challenging. And I'm happy, I know there's going to be questions about that, so I'm happy to discuss that. Making sure whether you have a program of research, that research is being tended to by others, making sure your dean and your associate dean for research are extremely supportive of this effort, making sure that those people who are helping you, throughout your career, making sure that you tend to all of those relationships. Also, you don't want to sort of just like leave your home institution and not report back on what you're doing or not engage in some meaningful way. But this is a full-time role. And so I think you sort of have to think about how to walk that line. I've had tremendous support from my dean and my associate dean for research in doing this. And I also have a really strong, co-PI as part of my research team that's really helped to keep, the wheels turning on that end. So I think those are the sort of barriers and some of the like push and pulls that a lot of people may be dealing with when thinking about this particular fellowship.
Okay. So we do have one question that has come in about how did you know the NAM policy focus for the year that you were NAM nurse, so from 2020 to 2021?
So there actually isn't a policy focus for that particular year that I know of. So I guess the last 2 years, the Future of Nursing report would be clear as something that the nurse scholar would work on. So in that way, it was, sort of clear that that was something you should be sort of ready and willing to engage in. But in terms of my work in child health, or some of my previous colleagues' work, Dr. Squires and aging workforce and things like that, you don't have to have a particular focus or program of research or health policy interest in order to be in this program. What I will say, though, is that you should think about how your work can align with work that's happening at the National Academy of Medicine. And there are lots of ways to do that. The website is one particularly great way to see what consensus studies are happening right now, what consensus studies will be happening in the future, you know, where the Academy is prioritizing their you know, strategic work going forward. I had applied right after a report called Healthy and Vibrant Kids was put out. And I was particularly interested in that report in large part because there wasn't a nurse on that consensus study. And I felt like it was a place that we could be really helpful in. And so my work this year, which I think perhaps is a question that someone asked, my work to continue the rest of the 8 months will be on two things. So I will complete my work on the Future of Nursing report. And then I've also joined a new consensus study that started in December called the Opportunity Gap from Birth to 8, funded by a number of funders, but some of the leading funders are HHS, the Agency for Children and Families, the Gates Foundation, and the Kellogg Foundation, among others that you can certainly find on the NAM website. But thinking about what is happening, what's gonna happen, what has maybe just happened that, you know, should have had the nursing voice in it is a really good way to see where you can add value to the National Academy.
So that's really good advice. You know, one question that's coming in from someone, they're just asking about the format of the application, you know, following a research format with specific aims and approaches, you know, is there a preferred template? When you were applying, you know, did you, can you talk a little bit about, you know, how specific you were with, you know, what you were putting in for your information on your project? Was there a template that you kind of came up with? I think it sounds like for this question, they're trying to figure out how to frame their application.
Sure.
What advice would you give?
Yeah. So I framed it more about myself and less about the project, kind of like you know, who I am and what I bring to the National Academy of Medicine. So I sort of in the beginning talked about who I am, the sort of what underpins my beliefs in science and teaching and service. My educational background, I did certainly talk about my program of research and how it links to the work going on at NAM that I would be most interested in being involved in. I spoke to the policies, you know, sort of governmental policies that I was really interested in having a voice in, but I did not do like a more traditional NIH style grant with specific aims and things like that. That is not how I framed my application. And I, you know, Christine, you're the one that reviews the applications, but I don't think from how I read the, you know, requests for applications, I don't read it as that's what they want, right? They want to know about who you are and what you bring to this fellowship, rather, which includes perhaps your program of research and perhaps other things, right? Many of you may do other things besides the work that I do. But how you can enhance this program and what expertise you bring to the National Academy of Medicine.
Okay. So, you know, in putting together all the application materials, approximately how long do you think it took you to put all of that together? Realizing that we're, you know, almost a week away from the deadline.
So everyone works differently.
Right.
Some people can write really beautifully written, you know, grants and papers and fellowship applications in a really short time. And some people, it takes many iterations of them. So I would say I sort of recognize that, and you all know how you work better than I do. I would say probably a real intensive part of it. You know, I may have had some of this, you know, inner working and thinking for a little while, but the intensive part, maybe a month. And that probably includes some of my mentors, you know, noodling with it with me and helping me to, you know, edit and think about it a little more. But I don't know if I think that's, you know, but maybe some of you all have some other, you know, things that you have to do that might make it take longer. I mean, this also includes that I've already had discussions with my dean. I'd had discussions with my associate dean, which they take time. So it's a tough question. The writing itself, probably an intensive month, but leading up to it, there were some conversations that I needed to have institutionally to make sure that I could, move forward.
Cool. So someone is asking a question that's pretty similar to, a question that I was going to ask. So I was going to ask you, like, how do you think being a NAMS nurse scholar will impact you and your career goals? And then in addition to that, what do you think you're going to bring back to your institution to move your work forward or help your colleagues do similar work?
Sure. Well, I'm really lucky to be in the Capitol, where a lot of health policy happens. And so I think a couple of things that'll be different for me. So I, in general, write NIH style grants. I think I'll probably look for opportunities to think about how the work that I'm doing can really influence policies in perhaps ways that I hadn't thought of before. So maybe partnering with some of the think tanks here in DC to write reports based on, my research and the research of others, thinking about how to get nursing's voice a little bit stronger to, be testifying on the Hill and those types of opportunities. And then to the extent that, we really need good science to then make its way to sort of our legislative colleagues, making important connections for advocacy and thinking about what advocacy organizations I can be helpful to. So whether it's joining boards or being more active in some of those policy conversations, I'm hopeful that those are the types of things that I've learned more and perhaps can certainly bring back to my institution, but also perhaps bring back to nursing a little bit more broadly.
Right. So, I think we have time for one last question, maybe two. Someone's asking about the interview process. Can you speak about, your experience or any advice that you would have for someone who, let's say they make it to that interview process? What advice would you give them?
So some of the advice I would give to sort of any type of interview. So remember who's funding this award. So there's 3 organizations. And so you want to make sure that you align or understand at least the strategic goals and the long-term ideas of what those organizations are about, what they want to do, what their goals are, right? Because you're representing them. And so you want to make sure that you, at least in some ways, align with the work that they're doing. I think that's one thing. You obviously, of course, want to know who you're going to be interviewing with and what their, big overarching goals are. So I always would say, like, those are, perhaps obvious ways to prepare for the interviews, but also, having talking points. So I think some of you have maybe gone through media training can appreciate that, whenever a reporter might ask you a question, you want to answer that question, but you also want to get through what your talking points are, what you want to focus on. And I would say making sure that you sort of have those pretty well established in your head, or maybe at least a few notes in front of you, knowing what you want to get across to the interview, to the people interviewing you. I had 3 people interview me. I had, I think, about a 10-minute sort of opening statement, and then it was a round robin question answer session.
So we have time for one last question before we get into criteria and how to apply, and if you have more questions. So, one of our attendees is asking, did you take a sabbatical from GW to be the NAM Nurse Scholar in Residence for this year?
Sure. So there's a lot of ways to craft the Nurse Scholar in Residence. Some of my colleagues have done it differently than I have. There's many ways to do it. So as you'll see in the paperwork, this is sort of nothing that I'm, saying that isn't written. There's a certain amount of money that's attached to this year-long residency. And so the way I did it was I sort of applied it in sort of a similar way as a grant would be applied, knowing that my dean would sort of understand that this was more of a full-time thing than the stipend or the amount would cover from my perspective. But it also depends if you're on a 12-month salary or a 9-month salary, right? Those are some nuances that exist. I did not take a sabbatical to answer the question, but there are colleagues of mine who do, in which case there may be ways that the stipend is applied differently. So from my case, The stipend went directly to GW and did not come to me. If you take a sabbatical, it's possible that, you know, depending on your institution, every institution is a little bit different in how sabbaticals are paid, you know, that money might come to the scholar themselves. I think there are, you know, multiple ways in which people do this, and there is not a right way or a wrong way, but there is the way that your institution uses it. So I think that's important. I have continued my NIH grants. And so I think that, I know that's an important question that a lot of people have that are mid-career. I do have an NIH grant that I currently have. I happen to have a co-PI on that grant who will be going on maternity leave next year. So we're going to be flipping roles where she's taking a little bit more of the, you know, the PI role right now while I'm in this. I do think it's a little bit of a juggling act if you do have that. I don't think it's impossible. I think it is possible to keep those awards. I do think you probably need like a really strong coordinator, and it kind of depends where in the project you are. You know, if your data collection is going well, you know, that might be easier. If your data analysis, that might be easier, but, you know, very beginning, very end might be, you know, it just depends on you, but it's possible if that's the question.
That's actually a question that popped up right before you started answering that. So that's great. You know, I want to be respectful of everyone's time. I know at 3:20, it's 3:26. So I'm just going to share my screen and maybe go over the criteria and how to apply quickly. See if this will work. Okay, so you know, this is the criteria that's in the application flyer that we've sent out. You need to be a fellow of the Academy of Nursing. You also need to be a member of the ANA. You know, your scholarly and professional achievements need to align with the health policy priorities of NAM, as well as the 3 sponsoring organizations. You know, obviously, if you're applying to be a NAM nurse scholar in residence, you have that potential to, you know, significantly contribute to future health policy, no matter what level of government it is. Clearly, you need to have a commitment to interprofessional collaboration, diversity, inclusivity, and equity, and clearly, you know, having effective communication skills and being able to process information and analyze evidence, and, you know, be a good writer is definitely skills that will help you succeed as a NAM nurse scholar. And then just quickly, you know, as a reminder, you know, the deadline is fast approaching for the 2021 to 2022 NAM Nurse Scholar. Your application, as you can see here, the packet's going to include 3 things. It's going to include your proposal, and, you know, we've discussed, you know, what are some good kind of advice to follow when putting that together, either a CV or a resume, and then also a cover letter that, you know, complements your CV or resume, and it talks about all of your experiences, what your interests are, you know, your ability to, you know, achieve work on your project as well. Obviously, you know, full-time commitment to the program. And then, you know, we're asking for 2 individuals that we can speak with that can talk about, you know, you as an applicant, your previous achievements, as well as, you know, what some of your experiences are. You know, I know we are fast approaching the end of this webinar, and I'm sure that there are plenty more questions. I know, Ashley, you've been very kind to people who have reached out to you. I know I've talked to a few people just this month alone about the process. So we have a deadline of next week, Friday at 5 o'clock Eastern, to send your application in. You send it via email, and it's going to go to Sonia Desai here at the Academy, and her email address is up on the screen here. Just make sure that in the subject line that you put NAM Distinguished Nurse Scholar Application in that subject line, so we can make sure it doesn't get lost. Also, you know, again, I'm sure there's going to be many more questions. My email contact information is up there on the screen. I'm sure, you know, Ashley will be, you'll be happy to answer any questions, if any further come your way as well. So before we leave, do you have any like last thoughts, Ashley, that you would like to dole out before we end?
I just want to answer a question that I think has come through a couple of times just since we're recording this. It's about the in-residence portion. So I'll just say again a little bit what I said before. September through December is absolutely in residence because it's 9 to 5, Monday through Friday. COVID has made that a little bit different because the National Academy of Medicine has told their staff that they can work remotely during this particular time. So for me, the option was given to come into the National Academy for some of the days, but I don't anticipate that being the case going forward. So I very much anticipate it to continue that you do need to physically be in DC September through December, sort of full time. January through the end of the fellowship, I think it depends on the consensus study you're on and the work that you're doing. I think some of the previous fellows have come to DC 3 or 4 days a week, depending on where they live. If they're from the Northeast, maybe taking trains down have been possible for partial weeks. Other colleagues have stayed here full time. So to that end, I know a bunch of people had that question. So I just wanted to make sure I answered that in that, yes, it's in residence. Yes, there are some more intensive months that you really do need to be here 100% full time, and maybe some other months where you might be able to travel in sort of a hybrid fashion, you know, a consultant's life where you're here, you know, a few days a week, but maybe not the entire week. And frankly, I wouldn't be surprised if that part became easier because of COVID. You know, I think the beginning policy orientation will largely remain in person, but I do think that given what we've all seen and probably your institutions have done over the past year, you know, the back end of it may look slightly more flexible.
Okay. Well, thank you, Ashley, for being here today. I'm sure, you know, we've answered a lot of questions that people have had as they are thinking about applying for the NAM Nurse Scholar in Residence. So I really appreciate that. We did record this session, so if you are seeing it and you need to go back and review it, it will be up on our website shortly after we conclude. And thank you everyone for joining us today. Hope everyone has a great weekend.